I'd like to invite Abe, who's now going to talk to us about how people who experience homelessness are being impacted by the COVID-19 pandemic, and also what he's seen as community responses to tackling homelessness.
Well, thank you, Sume, and thank you everyone for joining us for this webinar. It's so much information out there right now around COVID. I think it's just a privilege that you've chosen to spend a little bit of time with us for this discussion. What I wanted to share in terms of issues of homelessness is for sure some of the negatives, the downside of what people are experiencing, but there's also some positive in this. I wanted to try to pick up on some good things or some potential as well through this crisis. And so very similar to what both the others have said is that there's this exacerbation of existing issues. And so coming into this pandemic, the situation around homelessness in Canada was, for most communities, not all communities, but for most communities, it was as bad as we had ever seen. I'm in London, Ontario, and our rates of, for example, people who are rough sleeping or urban camping had been higher than we'd ever seen before by a magnitude of about 4 times higher. Shelters full, and this is really, as the whole housing market has financialized, as governments have looked primarily to models of affordable housing instead of rent geared to income or social housing, we've seen this huge exacerbation around housing instability. And so we came into this situation with really no capacity in the system. And so obviously, as was already mentioned, the idea of folks social distancing or physical distancing who are in either a situation where they're urban camping with other people or are in an emergency shelter where they're sharing, 6 cots in a room up to 100 cots in a room. It's just not a reality for them. So it's important to note as we think about pandemic responses that's not a new concern. There was a bunch of materials created after H1N1 about experiences of homelessness. And what that looked at was about this idea of distancing, above and beyond the idea of personal hygiene. But how do you actually create space when folks have no other places to go? And one of the challenges that they found, and what we've been hearing as well, is it actually puts not just the folks who are residing in shelter in a dangerous position, but it also puts staff in danger, both in terms of physical danger, but also in terms of this moral distress. And so that's idea that someone comes to shelter, they ask to be admitted into shelter, and the individual admitting them knows that they're actually bringing them into this space where they could be physically harmed, right? And so the shelter workers are in this really difficult crisis where, well, I don't want to leave someone, out on the streets, but at the same time, I know that it's not safe for them to come in here. And so we're seeing that same crisis, that same concern replicating itself across communities, across Canada. Now, the positive side, and I'm sure most of you have heard about this, it's been pretty big in the news, it's been part of the lobbying across the country, is this idea of the hotels, motels. This is different than H1N1 because H1N1 did not have the same impact upon travel, and so hotels and motels remain full. In this pandemic, there's a real opportunity that's come up by having these new empty spaces. And so, like I said, it's in a context where the housing markets were absolutely full. Now, the housing markets are probably going to change. We're already seeing people dumping Airbnbs into the rental market. There's been some popular vacation communities, for example, have seen up to 3,000 new rental units in a single month. But in terms of the hotels, motels, this is a real opportunity for us to leverage some of the new government funding on homelessness to put people into safer and better places. And so the positive side of this is that it's actually in the very early days, it's already beginning to demonstrate the impacts of folks having their own safe space. And so that idea of, yes, it's still just a room, but it's also folks having their own bathroom, it's having their own lock on the door, and it's even having something like cable television. And so we're seeing many of the folks who are being placed into these hotels and motels having quite good outcomes. So we're seeing improvement on health, we're seeing positive improvement on social outcomes as well. And so for me, this is a real message that we can learn from this, which is that emergency shelters they do amazing work. And don't hear me saying anything bad about them. I work with these folks in communities here in London and across Canada. Incredible compassion, incredible charity, incredible work that they do. But we also know that the outcomes of long-term stays in emergency shelter are not generally positive. We know that health outcomes decline. We know that social outcomes decline the longer they're staying. And so we're seeing on the flip side, if folks are given an independent space and they're given that safety and control, that there's a real improvement. And so for me, that really starts to beg the question of, how can we take what is happening now and make sure that we replicate and expand upon it for the future? And so for me, there's a real call here for the governments to think about creating more permanent and safe and independent living spaces for folks. And it really draws us right back to what started happening as long ago as the 1980s, as the government stopped developing new social housing and switched the model in the early 2000s to affordable housing. So definitely some negatives in terms of people's health and safety at this moment, but some positives as we see some ways that we can adapt in terms of having a better outcome for folks. I did want to mention as well the policing that has already been mentioned, and of course this affects folks experiencing homelessness. I wanted to highlight how much this is municipality to municipality, and some real work that each one of us can do in terms of reaching out to our city councils, our regional councils, to make sure that they're thoughtful about the way that they're handling this. And so there are two stories right out of Ontario on back-to-back days, one out of my community of London and one out of Hamilton. In London, our council and our police services have been very clear that they are not going to be ticketing people experiencing homelessness, that they're simply going to be providing warnings and reminders for those folks. On the flip side, in Hamilton, just up the road from us, there was a group of folks who were ticketed for sharing a bottle of alcohol after they had been warned. And so to me, it shows how precarious the policing situation is, that it really depends on how each municipality picks it up. And that's been the same for the hotels and motels as well. So here in London, we were out the gate with the hotels right away. Other communities still aren't there, or communities like Toronto are rolling them out slowly, and there's been a lot of kind of challenge and confusion about the intake process of how someone might end up in a hotel or motel. So that's what I wanted to highlight. I know that substance use is another challenge, but that was covered well in last week's webinar around safer supply of drugs and the impact on the drug flow. So please, for your action is some promising activities, is speak to your municipal council, speak to your, if you have representatives from your police services board who you can talk to, encourage the use of hotels and motels, and encourage them to take a stance that they're not going to be ticketing people experiencing homelessness, but instead will just be giving warnings. Thank you.
Great. Thank you so much, Abe. And I think you're leaving us with, you're providing us a very concrete thing which we can all do. We all live in communities. So Abe is asking us to speak to municipal councils and to contact our police boards around ticketing. And Abe, so thanks so much for that. as you talk about housing instability and affordability, I think across Canada, that's a challenge in many communities. And I love what you were saying about some of the positive things we're seeing, and really how at a community level and really even at a federal level we can act fairly quickly and come up with this fairly creative and innovative solution. So thank you.